everyone, I'm 𝗥𝗶𝗵𝘆 and today I'm here with 𝗥𝗶𝗵𝘆. So we are back with another role play, and today our topic is deep vein thrombosis, right?
Yes.
So we're going to see a patient who has approached you to get more information about the risks involved in flying with a DVT, because the patient has been diagnosed with DVT and the patient is planning to fly to Australia, which is a 6-hour flight from his place. So he has heard that there are some risks involved in it because he has DVT.
Yes, and
so
he has come to get some details regarding how to prevent such occurrences,
yes,
as well as how to understand whether he has got DVT or not during his flight.
Yes, so we have to help him to take some precautionary measures. So I'll play the part of the nurse and Grace will be handling the part of the patient. So without much delay, let's get started.
So your time starts now.
Good morning.
Good morning.
Please be seated.
Thanks.
My name is Richa, one of the registered nurses working in this community health center,
Okay.
and I'll be taking care of you today.
Okay.
Could you please tell me the reason for your visit?
Sure. I have been diagnosed with DVT, that means deep vein thrombosis, and currently I'm planning for a family trip to Australia, but I need to go on a 6-hour flight. So I'm really concerned about the possibility of getting another DVT, and I would like your support and advices for that.
Sure, I'll definitely help you with all the information that you need to know about it, okay? So I understand that you've been diagnosed with the DVT, and based on that I need to ask you some questions too. Will that be okay?
Yes.
So before we get into further discussion, could you please help me with your name and age?
You can call me James, and I'm 42 years old.
All right, James. So could you please tell me about what is your understanding about DVT?
I know that DVT means something like clot inside the blood vessels.
All right. And how long have you been suffering from this condition?
1.5 years.
And are you on any medication for that?
Yes, I'm taking warfarin.
All right. So from what you told me, I understand that you've been suffering from this for the past 1.5 years, and you take warfarin regularly for that.
Yes.
Okay. And as you told me that DVT is a clot in the deep veins, right? So I will take you through a proper overview about what is DVT. Okay. So it is a condition in which there is a clot in the deep veins, and if you have been diagnosed with it, you have to be extra cautious because we need to prevent the clot breakage. Because if there is a breakage, these clots can get loosened and get lodged in the lungs, and it can even become fatal. So it's a very serious condition. That's the reason why people with DVT are not encouraged much to fly for longer hours of time.
All right.
And when it comes to flying, you are not encouraged much to fly is because you'll be immobile for a very long time. So in this case, you told me that you are planning to fly to Australia, which is a 6-hour flight from here. So that means that you will be immobile for 6 hours, and that can cause poor blood flow, and that can increase the chance of another DVT too. Okay, so there are a few things that you need to keep in mind if you are planning to fly. Okay?
So what should I do?
Sure, I'll explain everything in detail for you. So the first thing you have to do is you have to look out for the potential signs and symptoms while flying. So if you experience pain or any tenderness with no explanation, that means you are experiencing pain and tenderness, but you don't know why exactly you have been experiencing that. Okay, you need to look out for that particular symptom first, and then if you notice there is a swelling of the leg or arm, or any redness on the skin, or if the skin is feeling warm to touch, these are all the indicators of DVT.
Okay.
So these are the potential signs and symptoms of it. Okay?
Yes, I understand that. So if I notice anything like that, then what should I do?
I'll take you through that, okay? So as I mentioned, there are a lot of signs and symptoms which indicate another DVT, and in case if you notice any of this, there are a few things that you need to do. Or in other words, I can tell you that there are a few precautionary measures that you can follow to avoid another DVT. Okay? Try to wear compression stockings, okay? And always try to stand and stretch every few hours while you're flying. Okay? That means you can just stand up or stretch your legs, okay, which will help to have a better blood flow. Okay? So that will be really helpful. And also watch out for the symptoms of DVT. I've explained the symptoms in detail for you, right? So make sure that you are looking out for it. So in case anything is noted, then you have to seek medical advice, or you have to start doing exercises right away.
Okay.
So on top of this, if you exercise the calf muscles while you're sitting, it can also increase the blood flow by reducing the chance of another DVT. Okay? And take the blood thinners as prescribed. Take the medications on time. All right. So if you follow all these things, we can, to an extent, reduce the possibility of another DVT. Okay? I hope that is clear for you, right? Yes. So I hope I've been helpful for you and answered all your concerns. So before I leave you, is there anything else that you want to ask me?
No.
All right. So I would suggest you to consult the concerned doctor under whom you have been taking the treatment. and get to know more about the preventive steps, because these preventive steps can vary based on the unique needs of the people. So it will be better if you can consult him before you decide to fly. Okay. So I hope I have clarified everything for you, and I hope I've been helpful as well. So if you have any further concerns or questions, please feel free to contact me. Okay. So thank you so much for your time. Take care.
Thanks.
So that's the end of our cue card discussion. So I hope it was helpful for you guys. So in this cue card, we saw a patient who has been diagnosed with DVT for the past 1.5 years, and he's planning to fly abroad, and he has concerns about the risks involved in it because he has DVT. So the only part of the nurse here was to provide information about the possible risks involved in it, as well as give him precautionary measures and advise him on how to look out for the signs and symptoms of DVT to avoid it in the future.
And what else he can do during the flight to control the problem.
Yes, so we have explained that in detail in this cue card, and I hope you guys are clear with it. So straight after this cue card, there will be the feedback session. So make sure that you guys watch it to learn how to construct statements in a very easy way for each task. So Grace and I will come back with another role play very soon. Until then, take care. Bye-bye. Alright, so that was a role play where we were talking to a 42-year-old software engineer who was diagnosed with DVT, and he has concerns about flying because he heard from others saying that there are certain problems for DVT patients when it comes to flying. So you saw how we can explain things to the patient and how to reassure the patient. All those things were explained in the role play. So in this feedback session, what I'm going to do is I'm going to show you how to construct statements. So we will pick each task, and then I'll show you how we can create statements for each task. So let's get started. So as you guys can see, our setting is community health center. So in order to identify whether it is a known case or an unknown case, let's have a look at the background information as well. So let's read it together. You're talking to a 42-year-old software engineer. He takes warfarin for DVT. He and his family are planning for a trip to Australia, which is a 6-hour flight from his place. He heard people saying DVT gets worse while flying. He wants to know more details. Okay, so nowhere it is mentioned that we do know this patient before, or that this patient is under treatment for DVT in our hospital. So nowhere it is mentioned like we know this patient before. And our first task also says greet the patient and ask for the reason for his visit. So this has to be completely taken as an unknown case. So let's get into the task explanation and see how we can do each task. So I will not be getting into the detail about how we can do the entire role play by discussing the reassurance statements or empathy statements, because you can refer to the video which was shown, which is a demonstration of how to do that role play, which includes every aspect of it. So for that particular area, you can refer to the video. And in this feedback session, as I always say, what we are going to look into is how we can construct statements, how we can break down different segments of these tasks and then develop it. Okay, so let's get started. So the first task is greet the patient and ask for the reason for his visit. So we had two things to do here. The first thing is we have to greet, and then we are checking why the patient is there. Okay, so let's see how we can do it. So I'm going to start like this. Good morning, I'm Ms. Caroline, the registered nurse on duty today. May I know your name, please? So the patient is saying, my name is Max. So you can say, all right, Mr. Max, how can I help you? So this is just one of the ways to do this. There are a lot of other ways to do it too, okay? Because when it comes to OET speaking, I always tell this for the live sessions or Zoom sessions or whenever I take classes, that we do not have a pre-developed script that we have to follow when it comes to the OET speaking, because it is totally a person's ability to do it, okay? So you just need to make sure that there is a logical order, or the scenario which is provided to you is executed in a way which is logical. So once you have got an idea about what the entire scenario is, you can develop the entire conversation based on your creativity. So you just need to make sure that when we look at that explanation, or when we listen to that particular explanation from your side, it has to be logical. There should be a logical flow of the conversation. Okay, so you can pick out the way which you're flexible with. So make sure that you're greeting the patient, you're saying who you are if required in this particular scenario, or depending on the scenario, if your explanation or if your introduction is required, then you have to do that, and then you have to state who you are, and then you have to offer to help. So this is the entire organization that you have to keep in mind while you are greeting the patient or opening the entire conversation. Okay, so this is just one way, as you can see here. So as you guys can see, this is just one of the ways to do it. So it's pretty simple, pretty neat and professional at the same time. Okay, so that is how you can do task number 1. Now moving on to task number 2. Acknowledge his concerns and gather information about his diagnosis and treatment regime. How long medications? So we have 2 segments here also. We have to acknowledge the concerns, because when we asked how can I help you, the patient will tell you the concern. So we are going to acknowledge it, and then we are going to gather information to know more about what is the situation and how exactly we need to help this particular person. So let's see how we can acknowledge. So I have made the bullet points, so it will be a little more easier for you guys to follow. Okay, so the acknowledgement statement is, don't worry, I'm here to help you. It's understandable that you have certain concerns regarding DVT. I'll clarify all your queries. So whenever you get a cue card, the first thing you have to identify is, what is the purpose of this entire conversation? Why the patient is there? What the patient expects from you, or what is the requirement of the patient. So based on that, you have to develop your conversation. So whenever you are using acknowledgement statements or empathy statements or reassurance statements, the entire idea is to connect with the patient, to develop a rapport, so that you can get a better score in the aspect of relationship building, or when it comes to appropriateness of language. So there are a lot of things which is behind it. So here what you have to do is, you can identify the requirement of the patient. The patient knows that he has DVT, and he heard from some other people saying that when it comes to flying, there are certain complications associated with DVT. It might get worse. So he wants to know more about it. So we know that this has to be an informative type of a role play, and you have to provide information and reassure the patient and give the right information to the patient as well. So based on that, when you give a response or when you acknowledge the concern, make sure that your response is appropriate to the query that was raised by the patient. So here the patient's concern would be, I have been diagnosed with DVT and I'm planning to fly to Australia, which is a 6-hour flight from my place with my family, and I'm really looking forward to it, but I've heard people saying that it might get worse when it comes to flying. So I am really worried about it. So he wants to know more about it, he wants more information. So we are telling, yes, I understand that you have certain queries about DVT and you're concerned about it, but don't worry, I'm here to answer all the queries. So make sure that your response is totally related to whatever the concern that the patient has. So that is your acknowledgement statement. The next thing is, we have to gather information. So you know that whenever you're going to collect information from the patient, you have to indicate the patient that you are going to ask some questions, so that the patient will be prepared and you're not going to ask the questions out of blue moon. So you have to signpost. Signposting statement is very important there, as well as you have to take the permission, because that's a courtesy, or that is the professional way to do that too. So you have to signpost in a way like this. Before we get into further discussion, I would require some information from you, so may I? So this is a very simple statement that I have used here. There are a lot of other signposting statements too. Okay, so you can use the signposting statement which you are very comfortable with. So I chose this one here. Moving on, we have a couple of questions. Our first question is, we need to know the duration, like how long the patient has been suffering from this, and we need to know whether the patient is on any medication too. So these are the 2 questions that we have. So my first question is, how long have you been diagnosed with DVT? Second question, are you on any medications for it?
Okay, so there are different ways to ask the same question too. So if you look into how long have you been diagnosed with DVT, you can ask it in a different way too, right? Like since when you have been diagnosed, or you can ask a different question like, so you told me that you've been diagnosed with DVT, could you please tell me about the time frame? So there are different ways of asking it. If it comes to, are you on any medications for it, you can simply ask, do you take any medication for it, or did the doctor prescribe any medication for you? So there are different ways to ask it. That is how you can do task number 2. Now let's look into task number 3. Give an overview of DVT and explain the possible risks involved while flying. Clot in a deep vein needs care to avoid clot breakage. Blood clots can loosen and lodge in the lungs. Immobility, higher risk of DVT while flying. So this is a task where you're going to give an overview of DVT, as you can see here, and then we are also going to explain the possible risks involved in it too. And there is one more important point that you have to focus more on, the immobility part. I'll explain that later, okay? So let's see how we can create statements. So we're going to say, Mr. Max, I assume that you already know what your condition means. The reason why I said like this is because Mr. Max does know that he has DVT, so which is understandable that he would be knowing about it, okay? So that's the reason why I used a statement like, I assume that you already know what your condition means. Nevertheless, I would like to explain it to you briefly. I know you already know it, but I would like to add some points, or I would like to give an overview, quick overview of it, okay? So that's the reason why I created or constructed a statement like this. Moving on, I'm going to explain what is DVT. So I'm going to say DVT is a condition in which there is a clot in a deep vein, which is mentioned here. And then I'm going to say you need to be very careful to avoid the clot breakage, because if there is a clot breakage, blood clots can loosen and get lodged in the lungs and cause severe complications. So this is the point. This area, this is what I have been explaining, okay, this point. And moving on, I'm going to also say one of the main factors that trigger DVT is immobility. This is the reason why I told you this is an important point, because we have to explain that. When it comes to flying, you will be immobile for a long time, which in turn increases the likelihood of a DVT episode. That is why doctors advise people with DVT not to fly for longer hours. Okay, so we explained the main point. Because of immobility factor, there is a higher chance of DVT while flying. So that is the reason why we do not advise people with DVT not to travel. So the next part is, once you have explained all these points, you have to make sure the patient understood this, because I'm not including that here. You have to ask a question like, I hope you understand, or are you following me, because it is very important to check the understanding of the patient. I'm not including that here because I'm just showing you how to construct statements for each task which is given here. So when you refer to the video, make sure that you look at the entire format there, okay? So moving on, let's look at task number 4. Inform the patient to look out for potential signs and symptoms while traveling: pain or tenderness with no explanation, swelling of leg or arm, redness on the skin that is warm to touch. So here also we are going to tell the patient there are certain things that the patient has to keep in mind if at all he is traveling. So please be relaxed, Mr. Max. There are a few things you can keep in mind while you are flying, which can help to avoid a sudden onset of DVT. So we are going to explain the things that he has to keep in mind to avoid a sudden onset. So we're going to say, always be vigilant and watch for potential signs and symptoms while you're traveling. This is the point. To look out for potential signs and symptoms while traveling. So I used an usage like this: always be vigilant, and look out was changed to what? Watch for potential signs and symptoms while you are traveling. And then I'm going to explain what I mean by this signs and symptoms. So I'm going to say, by signs and symptoms, I mean pain or tenderness with no explanation. Pain or tenderness with no explanation, swelling of legs or arm, and redness on the skin. The skin becoming warm to touch is also a symptom indicating DVT. Okay, so I explained each point here. So that is how you can do task number 4. Moving on to task number 5. When asked, explain the precautionary measures to be taken, and you're going to explain about the usage of compression stockings and things like that. So let's see how we can explain that point. So I'm going to start like that's a reasonable query, because the reason why I used a statement like this is because here I saw when asked. So when asked means when the patient asks you this question, right? So we are going to, so we can understand yes. So here the patient is going to ask me something. So that's a query. So I'm like anticipating it and I am using the statement. So that's a reasonable query, Mr. Max. I will definitely explain few preventive measures for you. Wearing compression stockings is highly recommended, as these can improve the blood circulation and reduce the risk of swelling or worse, deep vein thrombosis and clotting on a long flight. So I've seen the students doing this particular task in a way where they just pick out and tell them the suggestions like wear compression stockings, do this, do that, stand, stretch, like that. So you don't expand it, or most of you don't expand it or try to give an explanation as to why it was suggested. So if you know the usage of it, okay, if you personally know why it is recommended or why that is a wise option, it would be good if you can elaborate it like the way I have shown here. So I told them the usage of wearing the compression stockings, which is good to have a good blood circulation and also to reduce the risk of swelling or the risk of worse deep vein thrombosis and clotting on a long flight. Okay, so that is an extra explanation that I have given here. It is optional. If you know, well and good, please try to do that. Okay. Then moving on to the next suggestion, standing and stretching every few hours. So I used an explanation like this. As you will be sitting for a long time, make sure you stand and stretch every few hours. This can also help to improve the blood circulation. So that is how you can do that. The next one is, most importantly, always be alert and look out for the signs and symptoms as we discussed earlier. So the previous task was where you explained about the signs and symptoms, and we also suggested or advised the patient to look out for it. So we are again reassuring, or we are reminding, not reassuring, we are reminding the same thing. So that's the reason why I said as we discussed earlier. So in order to explain the same points that you have already explained, this is the best way to do, like as I mentioned earlier or as I told you before. Instead of repeating the same point again and again, it is the best thing to do. Then the last point is blood thinners as prescribed. Take the medications as prescribed by the doctor at the right time. Simple as that. Okay, so that's how you can create statement for task number 5. Let's look at the last task. Task number 6. Suggest consulting the concerned doctor about other preventive steps based on unique needs. Okay, so here we are going to recommend the patient to see the doctor, because the preventive steps is not the same for everyone. Depending on the unique needs, there would be some things the patients might need to do extra or might not do. So it changes depending on the people. So it is always good to see the respective doctor and to get an expert advice. Okay, so we're going to see how we can create a statement there. So I highly recommend you to consult your doctor and discuss it with him. Your doctor can give you more details regarding your condition and the preventive measures you can take while flying, as the preventive steps are based on unique needs. So that is how you can explain. So when you read this particular statement, you can see that the entire point that was supposed to be conveyed in task number 6 is clearly stated there, and when the patient hears this, the patient will also understand, yes, my needs is different from someone else, so I cannot follow the exact same thing like what everyone else is doing. So sometimes I might need to do something different which is pertaining to my needs, like unique needs. So it will be good that if I consult the doctor, so the patient will also get the clear idea about why you suggested that point. So that is how you can do it. So these are the different tasks involved in this particular role play card and the different sentence constructions that you can do as well. So I hope it is clear for you guys and I hope it was helpful. Alright, so by that we have seen a demonstration of the role play as well as a sentence construction session where you learned how you can construct statements for each task. So I hope it was clear for you guys. If yes, let us know in the comment section and I'll come back with another video very soon. Until then, take care. Bye-bye.
IILT, it's my cup of tea.